Hello and welcome to Hellie's Clinical Trial Adventures. There's been a few things happening since last blog. Some of them just like a few hours before I'm recording this, so I will try and get it all, the important bits, and not waffle on too much, maybe in some somewhat chronological order. Anyway, on Sunday, I was in my kitchen and I was baking, and I suddenly started getting these crippling pains in my stomach. Well, I say stomach, it was more like sort of just underneath the ribs. Can't see where I'm pointing, but I think you know where the ribs are. Just under there. But before you say, that was the MS hug, it wasn't the MS hug, because I've had that before, and this was very much like more abdomen rather than, on the side. And it was bad. It was really bad. And it came and it lasted for a while, and I was toppling over almost with pain. I called my husband. He was in the living room with the kids, and I sort of said, this is not good. And then it sort of stopped a little bit. So I thought, okay, well, I'm supposed to let Adam Brooks know, or the clinical trial team know, when things like this happens. So I gave them a call and was actually put through straight to Professor Coles, which made me feel very embarrassed to be bothering him on a Sunday. So I told him what had happened, and obviously one of the things that they list as side effects is stomach cramps, when you could get some problems with your pancreas, which is one of the more serious side effects. So that's kind of why they want you to look out for things like that. So he said, well, it doesn't sound like it would be that, because then it would be constant pain, and this seems to sort of be coming and going a bit. But if it gets worse, and if you go to A&E, do let me know. So I sort of hung up, and it wasn't gone completely, but it felt better. And I got on with what I was doing in the kitchen. So I'm a very keen baker. That's one of my hobbies. So that was kind of what I was supposed to be spending my Sunday doing. And then I was unloading the dishwasher when it suddenly hit again, and it started being so bad. So I said to my husband, I think I need to go to the hospital. He was a bit, saying, are you sure you're not being hysterical? Is it actually that painful? Which made me want to kick him a little bit. But, he was just making sure that I wasn't overreacting. But this time I really wasn't. It was nasty. Having given birth twice, I do kind of know my levels of pain. It wasn't as bad as giving birth, but it was bad. So I called up again and got put through to Professor Coles and said, I'm going in. The pain was so bad, it was so embarrassing talking to him, because I was crying on the phone. I don't tend to call people and cry on the phone. I like to think of myself as being quite composed when I talk to health professionals. But yes, I was I suppose the technical term might be a hot mess. So crying and blubbering, he said to me, okay, well, ask them to do a test for a specific thing, which I now can't remember what it was, but I had written it down. So I came to the A&E after an excruciatingly painful car journey, hobbled into the A&E, told them that I was on a clinical trial and I was having really bad pains, and it could potentially be side effects of the drug, but it could be something else. I didn't know what it was. Could they test for this? And but they got me into the sort of urgent care, adult care, quite quickly. Took my blood, and then I saw a nurse first, and then I saw a doctor, and then they sent me off for some x-rays and things. I think all in all I was there for about 4 hours, which for the A&E isn't really bad at all. And the tests came all back okay. So the doctor who'd been seeing me said he wanted to go and do an ultrasound on me as well, just to make sure. And then when he was doing the ultrasound, I suddenly thought to myself, hang on, what about like kidney stones or gallstones? I know some friends that have had that. And then he was sort of starting to scan, and then he said, you know what, I think you might be right. And then he sort of got to the gallbladder part, and he went, right, I'm going to go and get another consultant. And then this other guy came in. It was hilarious. It's very funny. It's nice to know that doctors can keep that sort of sense of humour when they're working as much as they do. I'm getting sidetracked now, but I just have to say, the NHS is blooming marvellous, because, you know, these people were fantastic. It was so busy. They were so nice. They took me serious, because if you come in with stomachache and you don't know what it is, you kind of think, you worry that you're going to be fobbed off and kind of sent home to whatever. But no, they were brilliant, really, really good. So yes, the funny consultant, he said, oh, well, this is 2 centimetres. Anything that's over 0.5 centimetres you have to name. So I didn't. I might have to name my gallstone now, but yeah. So basically, all in all, that was probably what caused the pain. And now my gallbladder needs to come out. So now I'm going to go get on a queue for that to happen. So I sent a text to Professor Cole saying, well, it seems to be completely unrelated. It's to do with the gallbladder, they think. The other test results came back okay. Should I continue taking the drug? Which they said, yeah, please continue taking it. So I did, and then Monday, which was yesterday, I was at home because I felt really rough. I've been getting a sinus infection because I feel a bit like I've been hit in the head with a baseball bat. It's really not pleasant. I get sinus problems quite a lot. And I was really headachy, and also the aftermath of all that pain on Sunday. So I stayed at home yesterday. And then today was my visit up at Adam Brooks. So I had to tell them all about what happened on the Sunday, and they listened to me, and they sort of said, well, okay, well, let's take your bloods and do everything again. And then they prescribed me with a month's worth of Bexarotene and sent me home. And then I got into the office, and I was doing some work, and I suddenly had a phone call. And I thought that it would maybe be my GP letting me know about what was going to happen with getting on this list for having surgery, because knowing that this will probably take months and months and months. So that's what I thought. But to my surprise, it was Professor Coles. And it seems that my blood test had come back from earlier today, that my liver values have gone funny. And he said it had taken quite a dip since last week. So I needed to come off the drugs, and then I need to come back in again next Tuesday, and they need to retest me again. So what does this all mean? I don't know. And he said he didn't know either. So potentially it could be related to the gallstone. Maybe, I don't know biology that well, but it's all kind of connected. The bits that create bile and digest food and whatnot, it's all kind of down there somewhere doing its thing when it's working properly. So he said it could be to do with that, but it could also be that I am actually on the drug, and that's what's causing the liver values to go funny. Now, because he doesn't know whether I'm on the active drug or not. I'm guessing some of the consultants that are on the trial will kind of know some people, whether they're on there or not, just from judging their values up and down, rather than the people on placebo. Excuse me. But I suppose with my case now, having this whole gallstone thing happening on Sunday, potentially that could have sent my values being funny. So they don't know. So I feel a little bit miffed about having to stop taking the drug, to be honest. But obviously I don't want to get, liver failure or anything like that, because that would not be a pleasant thing to happen. So yes, off the trial for now. Hopefully back on the trial again next week, but we'll have to wait and see. But meanwhile, I guess I'm just trying to eat healthily. When you read up about gallbladder stuff, you find that it can be brought out by eating fatty foods. Now, I'm not meant to eat fatty foods because I'm on this drug trial. One of the things that it says is to keep a healthy diet. So I will confess, I will be honest, that last week I did have ice cream twice, and I had some rather large cookies. And that was sort of 2 days before the problems happened on the Sunday. So I don't know. Could be that. Could be completely unrelated. Who knows? Hopefully I will find out both about gallbladder removal and getting back on the trial, and also my liver misbehaving. My sinus infection, on the other hand, is being treated. I have started taking penicillin for it because I really, frankly, had it of having headaches and feeling really lurgy for nearly a week now. So yeah, it's all kicking off. But yeah, I'm okay otherwise. So I thought that there wasn't going to be a vlog next week because I wasn't going to go into Addenbrooke's, but now I am. So I'm guessing I shall see you next week. Bye.